Well, hello there. This is Scott Callahan, and I am here for the Aesthetic Dish to speak to an incredible company, a fast and rapidly growing company that is from Mission Viejo, California. The executive leadership team has flown all the way 5,000 miles across the country to join me to talk threads, exosomes, silfirm, new technology from Korea that's changing the aesthetic industry today. And here, my first guest is Ethan Min, who is the CEO of the company, Susan Samarakone, who is the vice president of the company, and finally, Dr. Jeonju Na, who is the inventor of the Silfirm X radiofrequency microneedling technology. This is the most advanced version of it in the United States, and we are so happy to have the three of you on the show. Welcome.
Thank you.
Thank you.
So first of all, you guys flew from California. It's a lot of miles. You were here for a big event for the Dolce Something. You are a hot young CEO of this company. When did you become CEO of this company, and how have you changed the leadership of this company since you've joined?
Yes, I became a CEO in 2017, toward the end of the year. So that makes about 5 years now. And then I've been working with the company Benev since 2006. So it's been long, 16, 17 years. And then again, obviously, with the changes that I brought forth, which was involved with new technology, the Silfirm X, the exosomes, and then the Miracle PDO, that was something that I wanted to do as I was working as a Benev executive prior to, which we focused more on the growth factor skincare technology, and we manufacture sold worldwide. But I wanted to bring this newest innovative technology from Korea and able to represent it here in US under our brand umbrella that we started, obviously, and then again, it's been 5 years of long journey. We've been having a lot of fun.
Susan, how did you get involved with the company?
I actually was hired about 9-10 years ago with the company, and we were just focusing on growth factors and our cosmeceutical line of products. And obviously now you know, since then we've launched our medical device with Silfirm X, which is incredible, sexy technology. And we also have our exosome technology. And then obviously the threads, which we have you to thank for bringing on so many providers to understand about our threads and our offering that we have.
And Dr. Na, you you bring so much to this company. What exactly do you do with the company? How are you involved with the company?
Actually, I'm a founder of the manufacturing company of Silfirm X. I founded the company in 2009. And
you guys have amazing threads. Now, I've been using PDO threads for 9 years. I'm absolutely in love with them. Anybody who knows me knows that I'm all about threads. Where the heck have these threads been? I mean, how is it that I just discovered this a couple of years ago? I mean, you have threads that are definitely better than any other thread on the market, and they're so unique. Where have they been? Why have you been hiding them from us? What's happening here?
Okay, so I'm going to try to make it very simple answer. 2018, November, right? We've got our first FDA approved 510K class 2 with Miracle PDO thread that has both cannula and PDO mounted together. We've launched it in 2019, March. So before, there are other brands that are out there that are bringing a thread with a class 1, which I was pioneering the way to bring it in and then level up the PDO through the class 2. We were the first one. That's why we couldn't really be there for you. And then 2019, that's when we started, and then obviously 2020, COVID hit. So we had about a window of a year that we kind of start marketing it, and then went down because of the COVID. But that was the main reason that we weren't there prior to 2019, because again, we wanted to wait to have a proper class 2 regulatory approval before we launched the product.
Right. Susan, the major advantage of Benev is that you guys have this wide portfolio. You have threads, you have exosomes, you have silfirm, you have needles, you have cannulas, you have skincare. I mean, that's a lot of stuff. What's the thing that's the most popular, like say the top 1, 2, 3 things that Benev sells? Where is most of your money made as a company?
Well, that's a great question. Our regenerative portfolio is the best in class of every single avenue, to be quite honest with you. When it comes to RF device, you can't beat the Silpharm X. So I think any provider that has that device should be using our exosomes, because that product as a post-topical treatment can really optimize any treatment result that you have. And you can use that solution in conjunction with normal regular microneedling. You can use it with threads like you use it. You can use it with hydrofacials. So the possibilities are endless for any provider that understands the technology and understands that this area is it's innovating. And we're always trying to be the company that's staying on top of it. I would probably say Silpharm X, our exosomes, and definitely our threads, but I think that's really, threads are going to pick up. It's getting sexier. People are starting to ask questions about threads. They want to learn more about it. And so it's things like this podcast that are really bringing more attention to that technology.
Right. And even with your company, I noticed you guys have developed a lot of relationships with providers in the United States who are now becoming trainers for your company or KOLs for your company. How are you choosing your providers? How do you reach out to people to know who the best is for threads? How is that decision made in your company?
So that decision is solely mine alone, to be honest with you. And then, sorry to say, but again, it's depending on the relationships that I have with the customer base that I have. Basically, you being one of our top KOL, I always go to you. I call you up. You point me in the directions, and I basically go and build a relationship. And I want to make sure that they become an authentic user of our product before I actually get in and propose anything. And we have also our MAB members that I dearly respect, that I've been working with them for the last 5-6 years. I go to them and ask them, and then again they will give me a rundown of who the person is, what type of relationship you can build upon. So I really relate well with my close network of people, and that's actually how I build my network with KOL. And a lot of ambassadors, a lot of KOL that recently added on is from obviously Dolce Vita Symposium, because this is an event I can build close relationship for 3 days, and then obviously with your recommendation, it really helps me. And then that's been I guess 2 years. I guess we add at least about 9 to 10 top KOLs through this event. So thanks to you.
Sure, Susan. When you see the orders come through for your company for threads or even exosomes, and you see on social media that there's a big movement by, say, groups like dermatologists or plastic surgeons that bash threads and say the threads don't work and that type of thing. But then you see the orders, and you see that all these orders are coming from hundreds of plastic surgeons and dermatologists that are world-renowned, all over the world. Why is there such a disconnect? Why is it that plastic surgeons and dermatologists are doing these procedures in the thousands in the United States, but yet Instagram is talking negatively about these procedures, which clearly they're doing? What are your thoughts on that?
I think it's just a fear of the unknown. Threads have been around, but it's been around in Asia and it's been around in other countries longer than it's been in the United States. I think you're really the pioneer in the United States of bringing in the threads, and so you see it and you see results. For plastic surgeons, they're used to cutting, and so for them to shift their mentality, I understand it's going to take them a little while, but that's why I think any kind of workshops, seminars, symposiums, it's really our responsibility to deliver good education, to deliver cadaver workshops, to do hands-on demos, to really amp up our training, and to have the best-in-class trainers that are out there that really spend the time explaining and encouraging these trainers to get the hands-on and to understand why threads aren't really the villain. Actually, if anything, it can make you about 7 times more than what you're making right now in the practice. So you need to. If you aren't on this boat, the boat's leaving without you. So you really need to understand why this is a technology that you need to integrate.
Right. I mean, if you look at the portfolio that you guys have, you're basically covering every need that the patient has. You have the Silpharm X, which is basically covering superficial skin plus deeper tissue like the melasma and doing things like acne scars and rosacea and hyperpigmentation and other things. You have exosomes, creating new growth factors and new collagen and angiogenesis and vibrance to the tissue. Then you have threads, lifting up tissue in all the right areas, essentially replicating the ligaments that had deteriorated over the years. I mean, the only thing in the portfolio that you basically are not offering at this moment are fillers, right?
And we're working on that.
Oh, really? So,
I can't say that.
I guess you can say that.
You can kind of say that.
Yeah.
It's a long plan.
It's a process.
Yeah. So is there something in the works?
Ethan will answer.
No comments then. Yet. I have a lot of friends in the filler industry, so I don't want them to start thinking that I'm competition.
Yeah.
I don't mind competition when I actually have it.
Yeah.
But we don't have it yet, so yeah,
Okay.
I'll leave it at that.
So, Dr. Na, I have heard so many compliments about you from the providers that have come to my symposiums and trainings. And when I speak to other dermats and plastics and people that really know their lasers and know their technologies well, they said that your comprehension and knowledge and understanding of radio frequency microneedling and other lasers is just unbelievable. They just really can't say enough about you. How does it feel? First of all, to be the guy who invented this technology. When you're in Korea or other places, I heard you're kind of like a rock star when you're walking around. Do people ask you for your autographs? And how does it affect your normal life?
Okay, I'm not a rock star, just common people, common man, like American accent. Yeah, so I can answer like this. Why I invent good technology? Because I want to help you to make money. So, but how can we make money? I think if we treat patients with very comfortable and safe and promising technology, then they should come again. So always I focused on the patients, what patient like. So I travel Korea and here US, and I always, when I go to any exhibition and convention, I go around to learn every technology always. Yeah, maybe that's why.
That's when they're asking you for your autograph.
Oh.
He's very humble, right?
Yeah, thank you.
Yeah. So I just want to go back a couple of things I didn't ask before, which is back to Ethan. Ethan, you guys have an elastigline thread and a forte thread. These are north to south threads that are a little bit different. Can you tell me just kind of in layman's terms the difference between the two threads?
Yeah, so both of them are molded thread, and you briefly explained already, and a lot of people understand molded thread versus the cut thread. So both are molded thread, and the line is just the one scale up when it comes to the tensile strength, and also the size of the barb that are attached to it. So we designed it, the barb of the molded area be longer than a forte. So if you're looking at area like jowl, if you want to have more heavy lifting from north-south technique that you described, you want to use something like line. And line isn't something like everyday thread. It'll be a forte where you do your normal lift for your mid face, low face, and again with your upper eyebrow. But if you want additional, that's where the line thread comes in.
So are you saying that size matters?
Size matters, right? So the barbs and that size matter. As far as actual size, it's the same. So and actually thickness matter too,
Yes.
right?
Yeah.
So that the line thread comes in a thicker form, and then again comes in a 17 gauge versus forte. The thickest is basically, as you know, only the 18 gauge.
You've got that dual coated thread that has that cone anchor tip, so you're gonna have just better asphyxiation even onto the tissue too.
Right. It's not about the length. Sometimes it's about the girth, right?
Yes. And then the as I said, the strength of that thread comes from that dual coated technology that we built it, and then again, it's cold molded, so it's also different from conventional molded technique that involve heats. But obviously our thread that makes the line thread comes with the cold molded. That actually makes it more stronger.
Are all molded threads from your company cold molded? No.
So then forte is not, but
Yep.
then line thread is.
Got it. And what about things like these reverse vector threads? Mint for so long has had Mint Fix, Mint Petite. Yeah, I know you recently guys came out with Forte Fix. Is that a similar thread, or are there going to be more reverse vector threads on the horizon for you guys?
Yeah, so the reverse, obviously thanks to you and some of the providers who kind of got into the whole reverse aspect, and then obviously I know the Mint will always listen, and then again they would also innovator, they also develop something new. We also are listening. So we came out with Forte Fix, we call butterfly fix, basically, because again it shapes itself to look like butterfly. It's again the innovation in it, a completely different design than the Mint. The way it works is slightly different, although the end goal as to what it does is the same. But yes, we are going to come up with different indication specific and different size of the fix for the reverse and fix for the fixations.
It's so clear to me, right, that the Mercury threads are the best threads for multiple reasons. They have the molded threads. They're not cutting, so they last so much longer. They have less inflammatory effects because of that. They also have an ability to go in to have less trauma to the tissue with the special tips of the cannulas. The price to the consumer is great. The profit margins are high. So I just don't get it. I don't understand why anyone would ever use another brand. It doesn't make sense. Like, I mean, you've seen an enormous amount of growth, but does it surprise you that you haven't grown faster because of the advantages of your product?
We're prudent. We're a very prudent company, so we're not there to win the race right away. We're there to actually build relationships, long-lasting relationships. So some companies will give you a training, they'll barely let you have a hands-on, and then they leave. That's just not our approach. That comes from the top down. So we're really looking at making sure that you understand the threads, you understand why you're selecting certain ones over others, you understand how to price it, you understand where to place it. That takes time, but we are in it for the long haul. I think that the more providers that are now joining on board with us, our incredible KOLs or MABs that have been with us from the beginning, the word is getting out, and I think that's really where we're seeing this growth now coming in.
Wow. And back to Ethan. Ethan, this company, Benev, is a private company, right? And the corporate headquarters of it is in Korea or is in...
We're Orange County, California.
Orange County, California. And will Benev ever be a publicly traded company?
Works in the way, and obviously we have a clear exit strategy. Goal is to exit, and then again, best way that we see now is basically take the company to IPO. Yes, but obviously it's a challenging, and with the growth that we have, we're gonna have to work harder to build the company for stronger. But again, that will be the goal that I have, me being a CEO at this point. Yes.
Got it. Ethan, so I want to talk to you about something very serious, and jokes aside. Last year, one of the thread companies came out with a campaign where they went to providers all over the country and sent letters to those providers. And what they said in that letter was that they have the only FDA approval, they have the right threads that essentially are correctly FDA approved, that their threads company provides better education and training, and that they're an ethical company unlike the other companies that exist. Now, this was essentially like a hack and slash campaign to basically destroy the reputation of many of the companies that existed out there, not just your company, but also Mint. And as a CEO and someone who knows everything about threads and and knows how they're manufactured and how they produce, aren't you angry from that? I mean, it makes me angry. As a CEO, you must be angry from that.
Actually, it frustrates me, and obviously I'm a better man than you are, so I can control my anger.
That's true.
That was a joke.
That's true.
But
you definitely control your anger better than me. That's for sure.
It frustrates me, and I've been dealing with that for the last 7 years, especially the PDO thread. I'm not gonna get into all the others. Mm-hmm. When I first saw the PDO thread, I was trying to bring it in 7 years ago. It took me 3.5 years to register. I failed 3 times in front of the FDA, and then I actually wanted to give up, but I persisted, and I finally got our first 510K Class 2 clearance. Right? When you see a company like that who use my approval as a predicate, use my writings, everything that I've done, which I wanted for the industry, by the way, because again, you could never grow alone as a company, right? You want to elevate your industry as you invite more investors. You want to push yourself to grow a company, but you want the competitions, right? The word gets spread out. But the company who use my 510K Class 2 as a predicate to register their products, now talking to everybody else, they're the only one. It frustrates. And then again, sometimes I was like, why would they do it, right? And then again, I have to sometimes joke about it because again, I know for a fact that we are the only and first one back then that have class 2 with the cannula with the PDO thread included. There are other companies that have registered the PDO alone, which I have a lot of respect for them. And then now there's more because we paved the way as an industry so that other people can face the FDA and get their product registered. I never get a credit for it, obviously. I just did it for myself. I didn't really do it for other people, by the way. But I think I contributed to the industry so that I showed the way as to how you can register PDO thread that are basically combined on the cannula.
But Ethan, it's not just the company that went out there and said that stuff. Unfortunately, there are thousands of injectors that are out there who have a big voice with Patreon and other platforms that are simply repeating what they've been told by these companies, and they don't even understand threads. They don't even know anything about threads, but they're out there telling them that one company is molded threads when they're really cutting threads, or their product is more FDA approved when it's not, or their product has more education opportunities when yours is not. And the problem is that the entire aesthetic industry is now completely confused because they don't know what to believe. So how do you change that? How do you go back to those injectors who, they may not even know better. I don't even think it's malicious. I think they're repeating what they've been told. But unfortunately, I think this campaign has set back the thread industry by years.
I have to agree with you, but at the same time, first of all, there's a lot of providers, injectors, and the doctors that I admire and respect who brought this industry of a PDO thread, and then I am grateful for that. But then again, I hear them talk about some of the stuff that are not true, right? And I don't think I can just go and stick my face out there basically and then confront that could, I don't know. I don't want to see the consequences sometimes. So I have to say I was very passive in approaching and then again face and confront those issues. And way for me to overcome that is for us to get better and then provide better products and then again work on harder to get more indication approved by FDA. And again, it's no secret, I'm working on getting more approvals of different threads and then using different materials. I think we're gonna pave the way moving forward. The innovations on development and then again, leading the way to get the proper regulatory registration on the new product is the only way that I thought that I can convince the industry eventually. And then again, change their mindset about our company if they didn't know. So it's
Dr. Na, the Silver X is a radiofrequency microneedling technology that steps up above the previous technologies that have been developed. Those technologies are things such as Morpheus and Vivace and Profound and Scarlet and other things that have come into the States. The Silver X is an incredible device because it has all these standout features. When you were inventing this device or developing this device, how long, like months or years, did it take to basically form this device?
I got the concept about Silvermax in 2015, and then I finished my invention and registered update 2019, and then from 2020 I start to work with Benev company.
Wow. I mean, the big limitations of the devices in the past have been that they couldn't treat tan skin. They had a hard time treating melasma. They were very painful. They caused a lot of downtime and reaction and swelling. And it seems that you solved all those problems with this one device. Would you say that this is there going to be more inventions, or is this it? Is this the best device that we'll ever have?
Silvermax has a very smooth driving motor system, but I developed the software to control the needle penetration pressure enough. So if you try on your face, you can feel very smooth penetration with a strong pressure.
So I'll start with you, Karina. How do you handle the day-to-day of hundreds of customers reaching out to you, looking for training, looking for orders? I just must be overwhelming.
So it does get overwhelming at times, but we do have these contracted reps who do help us. They're spread across all these different states, have a lot of different territories, and they do a lot of the groundwork, and we're really there for support. The beautiful thing about sales is that every day is different. So, it's not the same daily routine. One day might be a little bit more stressful than others, but it really is just supporting each other, working as a team, just trying to filter through and just be as effective as possible.
Dan, do you guys divide the calls that come in from different areas amongst the three of you based on your regions?
We do divide and conquer. That way we can offer a better service.
Got it. And Taylor, since you're on the West Coast, that's where all the heavy hitters are, so you probably get hit up the most. Do you find it overwhelming with all of your customers and clients out on the West Coast?
Well, not as much as Florida. But we definitely have a top the market and the aesthetic. But which is I would say is a mecca and the aesthetic, and we have obviously the heavy hitters, a lot of thread market and injectables as well.
Yeah. So Karina, Benev has a wide portfolio of products. They have Miracle threads, they have exosomes, they have Silpharm X, they have skincare, they have needles, they have cannulas, and that's just probably half of their portfolio. What are people ordering on a daily basis? What's hot right now? What are the trends?
So I would definitely say the exosomes are very hot, just because almost everybody can use them. They're very simple to use, very quick, have a long shelf life. So the exosomes are very disposable. They come in and they go out. The threads as well, because people are doing thread cases, more and more these days. And, once you get that training in, people are, hitting 10, 15 thread cases a week. So the threads are picking up.
Dan, in layman's terms, what are exosomes used for?
Are you calling me a layman?
Listen, I don't know if anyone would want to lay your man, but exosomes. The public probably doesn't know what exosomes is. What would be like a nice, simple definition of that?
I think the easiest, simple definition is just the next generation of regenerative medicine. So it's basically like a nanoparticle secretion of a stem cell. So same growth factors as a stem cell.
So people are using this in, I'm assuming, a variety of ways. They use this in skincare. They use this in healing, right? And then maybe also for sexual wellness.
Yeah, there's a lot of controversy going on, which is why it's such a fun topic. It's a brand new thing to the market. Of course, we're looking at how can we do this in a way that's going to build the industry in a proper way, and mostly just for facial and hair rejuvenation. And other people are using things at their own discretion.
Right. Taylor, when you talk about Silpharm X, which is a radiofrequency microneedling technology, a lot of people last year or the year before went out and bought Morpheus or something like it in their office. Because of those technologies were so painful or they had such problems, is it easy to convert them to Silpharm, or is it hard because they already have an existing device already in their practice?
I think it's a latter because obviously they are very similar device, and it's actually most challenging part of it. If the provider has Morpheus, it's very hard to convert it.
Sure. And this seems like Morpheus has like a cult to it, right? It seems like people are very loyal to that brand. They love it. Really didn't hear too much about it until recently when Kim Kardashian talked about having Morpheus on her abdomen. At that time, did the three of you, and anyone can answer, but did the three of you find that there was like a high demand for talking about Silpharm after that Morpheus story came out about Kim Kardashian?
I actually didn't hear about the story personally.
Okay.
I'm not always on social media.
Yeah.
But I did want to chime in. I think what's really...
You were probably buying your scarf at that
That
time.
actually may have been the exact moment. Yeah. I did want to chime in though. Basically, when I have a doctor approach me about why would I want to buy another device?
Mm-hmm.
I just emptied my bank account. I just mortgaged my life. Why do I want something else? When I point out you can use less pain management products to use this device, and when I let them actually demo it on their skin, that's usually the sell right there. And also the only one that does color treatments for melasma, pigmentation, rosacea. Usually that's like a win. I haven't really had any problems.
At the end of the day, people want the results of Morpheus. They don't want the pain or downtime of Morpheus, right? That's basically what it comes down to.
That's 100%. And I think once you try it and you feel like, oh, I can actually tolerate this pain, it's actually just like someone pinching me, or people say it's like pulling out one strand of hair. There's different analogies people are using. But once they get that, like I can give this to my patient in a much easier way, that's the sell right there.
Right. Taylor, with in this job compared to other jobs that you've had, how does this job require a lot of travel, or is it mostly, where the people are calling your house? Does it involve a lot of conferences? What's it kind of like day to day?
Well, traveling, obviously, I would say like 60%. We've been traveling, and we have a heavy amount of traveling this year. Prospect, that's our job. And then I think some level we have to find some balance in between the sales and managing sales people.
Right. Recently, your company took multiple providers to Korea, and you guys did a tour of the headquarters as well as went to one of the Korean conferences. Was that a successful campaign for you guys?
It went interesting. It was, I think overall it went successful, but it was very challenging every day.
Yeah, what were the challenges?
First of all, we were leading 12 total providers from the US, and it was our first conference with Demire. And it was for the Demire, it was the first time for them to have the foreigner speaker. And second thing was, everyone was jet lagged. So we had to juggle with the tight schedule.
Yeah, that's like a 15.5-hour flight, and then exhausted trying to make a tight schedule. And I know you guys try to put a lot in a little space of time, so I'm sure that was challenging. Yeah.
There's some kinks to work out for
Yeah.
this stuff.
But what was exciting about that is that very few American providers ever really get to go to Korea and see where these products are manufactured. And sometimes people forget that, but everything derives from Korea. I mean, they are so far ahead of us in the aesthetics that if you have the opportunity to go there, I'm sure it just like opens your eyes.
Oh yeah.
Yeah, in a big way, right?
It's definitely a life-changing experience, and I'm sure that the providers who actually ended up going have a different experience than the admin, because we're a lot, everybody's doing the back end stuff. Some of the stuff that's a little harder, and the providers there probably enjoyed their time. So.
Right. Yeah.
I think that's the beauty of being an international company, is really taking the best technologies from different countries around the world and then combining them for the best result for the doctor and the patient.
Right.
My job interview 7 years ago, and Ethan loves to tell the story, was literally to go to 7 countries and speak to people of different languages and see how that would work out. And so I just think that we, from our grassroots upbringing, was always about how do we kind of bring a conglomerate synthesization of all the different countries together for the best regenerative medicine.
Right. Dan, being that you've been to all those countries and you're international business manager for the company, would you say that the United States is very passionate about aesthetics? Are we addicted to aesthetics? Are we not as addicted as other countries in the world? What countries are addicted to aesthetics? Which countries are heavily about aesthetics?
Yeah, I think we are more balanced overall. I think we're a little behind. I think Brazil and maybe Korea, some of those countries, they're starting younger and they're maybe taking it too far. You probably know better than I do, like some of the problems that come with like Brazilian butt lifts and people dying. Like that's not a good side of aesthetics that I'm glad we don't have too much of here in USA. But overall, we're pretty well established with FDA oversights and making sure we're not going too crazy, but we're still a little bit behind the times. I mean, other countries are ahead of us, especially with threads, especially with exosomes, even the RF microneedling. So I think it's our job as an international company to bring that light and say, hey, this is the future, this is where we're headed.
The advantage of Miracu is that, they have a great utility thread with the Forte thread, similar to the Midfine. They have the biggest lifting thread of the elastic line. They have the mesh thread, which is, unique in its own right, great for nasolabial lines, great for tear troughs, great for glabellas. And then another important thing is that Benev is a wonderful company to work with a wide portfolio. So it's not just a thread company,
but it's a company that has so much more to offer, like the needles, the cannulas, the lasers, and all the education and training. So as many people feel, I'm sure, it's about the working with a company that you love. Benev is a great company to work with, and so that's how I decided to work with them.